Hi, it's Medical Injector Joanna. I know you probably already know a lot about the skin. There are hundreds of publications, studies, webinars, and trainings, all talking about the hydrolipid barrier, ceramides, fibroblasts, and collagen. But if you've been working with skin for years, you've probably felt that in this flood of knowledge, one thing is missing: structure and practical sense. This training won't be another repetition of old patterns. It's about understanding the skin anew, from the perspective of a practitioner who wants to know not just what works, but why and how it works. It's about organizing your knowledge, showing ready-to-use solutions, formulas, and connections between layers that will help you make faster therapeutic decisions. In this first lecture, we'll look at the skin from a wider perspective, as a complex biological system, not just a surface to treat. You'll see how skin physiology connects with anatomy, the microbiome, blood vessels, and subcutaneous tissue. Think of it as your reset and refresh based on facts, not to give you more information, but to help you find more meaning in what you already know. I've also prepared a diagnostic card for you, a practical tool to use with your patients when working with the skin. Feel free to open it now. Let's begin the first episode. And a very important aspect, hormones. After the age of 40 and especially during menopause, estrogen levels decline. This directly affects fibroblasts, which begin to produce less collagen, elastin, and hyaluronic acid. The skin becomes thinner, less vascularized, and less elastic. In practice, this means the rate of aging can even double. A recent review published in Frontiers in Aging 2025 pointed out that estrogens influence not only fibroblasts, but also epidermal stem cells and skin microcirculation, directly shaping the skin's ability to regenerate. To sum up, external and hormonal factors are not just a matter of lifestyle. They are biological processes we can actively modulate. Photoprotection, antioxidants, proper sleep, recovery, and hormonal balance are the foundations of every anti-aging strategy, because the skin always reflects how it is treated and the environment it lives in. Before you plan any skin therapy, pause for a moment and examine it closely, not just how it looks, but how it functions. Start by assessing skin thickness and density. This tells you how deep you can work and whether you need structural rebuilding or rather superficial stimulation. It's worth comparing different zones: cheek, jawline, neck, and if possible, complementing your observation with skin ultrasound. Next, look at color, vessels, and texture. If you see redness, telangiectasias, or uneven tone, it signals disturbed microcirculation and a potentially weakened barrier. Then check the skin's adhesion to underlying tissues. This simple palpation test tells you what aging pattern you're dealing with. Loose skin points to lost elasticity, while empty skin indicates volume loss. These call for different treatment strategies, so it's important to know which one you have. Next, hydration and the state of the hydrolipid barrier. If the skin is dry, flaky, and hyperreactive, it's not ready for treatment. First, rebuild the barrier. Only then consider injectables. Tiabule or corneometer readings can confirm this, but good observation and touch often suffice. TEL, transepidermal water loss, measures how much water the skin loses through the epidermis, i.e. barrier integrity, while a corneometer assesses water content in the stratum corneum, meaning actual surface hydration. Both parameters are measured with specialized, non-invasive probes that analyze water evaporation and epidermal moisture quickly and safely. For advanced diagnostics, assess the skin's bioreactivity, how it responds to pressure and microinjury. Observe blanching, hyperemia, or redness after a gentle press or tiny microstimulus, and how fast each appears. A quick, even response indicates good microperfusion and regenerative capacity. A delayed or excessive one suggests imbalance and the need to precondition the skin. Too strong a response means edema risk. Too weak suggests a poor biostimulatory response. Then evaluate ECM quality. Do a simple elasticity test. If the skin recoils slowly after a gentle pull, collagen fibers are already weakened. Also examine facial muscles, the face in motion. See where the patient compensates tension. Do depressors dominate or elevators? This is crucial when planning toxin, bioremodeling, and volumetry combinations. Note zones with poorer perfusion. Cooler, paler areas may indicate scarring or microembolization. Avoid deep work there. Choose gentle microinjection or drainage techniques instead. Finally, always ask about hormonal status, stress, and overall recovery. The skin reflects what's happening inside. in perimenopausal women, the biostimulatory response will differ from that of a woman in her 20s. Bottom line, good diagnostics are half the success. The better you understand the skin's condition, the more precisely you'll choose the therapy, product, and depth of delivery. I've prepared a clear summary for you to help you navigate this more easily and quickly identify what to focus on before planning any skin therapy. If you enjoy this content and would like to watch the full episode, register for free on VOD Vismed Online and get monthly access to the latest knowledge based on research and real clinical work with patients. You'll find the link in the description and in the pinned comment. Additionally, with the code START, you can access your first month for a symbolic 2 in your local currency.